Check patient's chart for doctor's order. Review patient's medical record including healthcare provider's order and nurse's notes. Note previous catheterizations including catheter size, response of patient, and time of catheterization. Review medical record for any pathological condition that may impair passage of catheter. In this case, there's no urethral strictures.
Good morning, ma'am. Unsa kani ang imong pangalan, ma'am? Okay. Pwede na ako matanaw ang imong wristband. How about ang imong birthday, ma'am? July 27, 1980. Naba kayo mga allergy, ma'am, na-experience sama sa betadine or iodine or plaster? Okay, ma'am. Kabalo ba ka sa imong timbang, ma'am? Pwede ba man nato ma-palpate ang imong bladder, ma'am? Okay, ma'am, balik lang ko, ma'am, no, para sa to ang procedure. Mag-catheter, takaroon, ma'am, sa imuha.
After performing hand hygiene, apply clean gloves.
Now I'm going to inspect the perineal area for anatomical landmarks, erythema, drainage or discharge, and odor.
Remove gloves and perform hand hygiene. Assess patient's knowledge and prior experiences with catheterization.
These are the available supplies that we have. We have here our fenestrated drapes, our bath blanket, our waterproof underpad. This is our cotton bud soaked with betadine, our pickup forceps. This is our operating sponge. This is our sterile water, the drainage bag, syringe for deflating the balloon as well as the withdrawal of the sterile water, our lubricant gel. By the way, this is our extra nursing personnel to assist me whenever needed.
Prepares equipment and brings preparation to the bedside.
Good morning, ma'am. Ako di ay si Charlie C. Sanchez ug si Geraldine Mendoza, ang nurse karong adlaw, ma'am. By the way, ang ato ang procedure na pagabuhaton karon mao ang catheterization. Buhaton nato ni siya, ma'am, para ma-empty imuhang bladder para sa imuhang umalabot nga surgery. Okay lang ba na sa imuha, ma'am? As you can see, we have the well-lighted room And this is the perfect spot for Foley catheterization. And now we will close all doors and windows to provide privacy.
Raise bed to appropriate working height.
Okay, ma'am. Dorsal recumbent position ta, ma'am.
For safety, let's provide bed protector. My client already had her perineal hygiene. I assume that my client already in a dorsal recumbent position. Let us open the pack and bring it near the perineal area and observe aseptic technique. Let's all just assume that these packs are well covered and aseptic. Squeeze a small amount of lubricant over the sterile operating sponge placed in the sterile field. Get 2 cotton buds with betadine from the jar and place on the sterile field on top of the several operating sponge. Put on sterile gloves. Let us just assume that this is a sterile gloves. Grasp the upper corners of the fenestrated or eye drape and unfold it. Place the fenestrated drape aseptically over the vulvar area, exposing the labia. Lubricates 1 or 2 inches of the catheter tip. Let us avoid clogging the lumen. With the thumb and forefinger of your non-dominant hand, spread the labia and identify the urinary meatus. Hold the thumb and forefinger of non-dominant hand. Then pick a sterile working forceps in the dominant hand. In cleaning the meatus, use 1 downward stroke for each cotton buds and discard. Maintain the separation of the labia until the catheter has been inserted. Ask the patient to bear down gently while slowly inserting the catheter through urethral meatus. Insert the tip of the catheter into the dimple-like structures below the clitoris, which is the meatus, about 2 to 3 inches or until urine flows. Introduce 5 cc to 10 cc of sterile water to secure the catheter. After inflating catheter balloon, release catheter from non-dominant hand. Remove the fenestrated drape. Connect drainage tubing to catheter if it is not already pre-connected. Gently withdraw catheter until resistance is felt. Then advance catheter slightly. Secure catheter tubing to inner thigh. Clip drainage tubing to edge of mattress. Position drainage bag lower than bladder by attaching to bed frame. Coil excess tubing on bed and fasten to bottom sheet with clip or other securement device. Check to make sure that there is no obstruction to urine flow. Remove and clean the equipment and make the client comfortable. Perform hand hygiene. Record the time of the catheterization, the client's reaction to the procedure, and other observations.